Good morning, everyone. It's great to have so many of you already online, and I see more and more are joining us rapidly. Thank you also for taking the trouble to register and to give us your time this morning. I'm going to ask, and this is Brian O'Connor from the ECHAlliance, I should have said that. I'm going to ask Julien Venne from the ECHAlliance to set out how this webinar will be as effective as possible with this number of people on the webinar. So Julien, if I may, I'll pass over to you if you could give some instructions to people.
Thank you, Brian. Good morning, everyone. As Brian mentioned, we are many people online this morning for this important webinar. So I will give you some explanation of how it will work. So for the agenda, we will start with a presentation you see on the screen from Ain Aaviksoo, Deputy Secretary General for E-Services and Innovation of the Ministry of Social Affairs in Estonia. So we will start with this presentation about the priorities of the presidency, which was starting last Saturday for the next 6 months. Then we will present the process and how this presidency will work with all the stakeholders in Europe through a process called Digital Health Society and present the associated event of the presidency next October in Tallinn. So it will take in total about 30 minutes of presentation. And then for the 30 minutes left, we will be able to answer some questions. Obviously, because of the numbers of the people registered to this webinar, we can't take verbally your questions. So we will ask you to write questions actually from the beginning. You can do that from the beginning. In the right side of your screen, you have a box called questions where you can type in your questions, and we will select the questions and answer it in the second half of the webinar. You are all on listen-only mode. Obviously, for the number, we are exceeding the 250 people online, so it's impossible to do in another way, but we will try to make our best to take all the questions. To tell you as well that this webinar is recorded, so the video will be available on the website we will mention in the presentation, the Connector website, and we will give you the link in the presentation. And the slides will be available actually as well in the website, so you will have access to the presentation. Okay, so that's it for me for the introduction. So we will go directly in entering the agenda, and then I will pass and give the floor to Ain Aaviksoo, who is Deputy Secretary General for E-Services and Innovation at the Ministry of Social Affairs in Estonia, and he will present us the European presidency and the priorities for Estonia for the next 6 months, especially for digital and health. Ain?
Thank you, Julien. Hello, everyone. I know it's morning in some parts of the Europe. It's past midday in eastern part, also in Estonia, and it is a true pleasure to have this kind of occasion to talk to the Europe. Estonia is now for the 4th day holding the presidency of the Council of the European Union. It is the first time opportunity for us, but we are really, all of us, very, very excited about it. For today's event, I am personally, and also all our presidency team, very thankful to the ECHAlliance, who has partnered with us in making perhaps a different approach to e-health. And I'm really giving a first introduction about what we mean by a platform that Estonian EU presidency is offering to create the desired meaning for e-health. Before getting into e-health, really as the main approach to the presidency, the intention and approach by Estonia is to find a balance in unity between all the views, traditions and interests in Europe today to achieve the best possible outcome for European citizens. And that applies also to e-health. And two domains specifically are relevant, two main domains in the program of Estonian EU presidency are specifically relevant to the e-health. First, we hope that during this 6 months' time we can work together to get closer to an open and innovative European economy. And that is important in order to stay competitive. That kind of economy, we believe, is where large or small can only be successful to work together in an open way to new opportunities, change, trade, and new ideas. And as the future most probably will be digital, that is also a big part of the whole presidency. And that means that prosperous and sustainable Europe should embrace technological transformation. And that is what we also expect to achieve in e-health. Now, public e-services are the cornerstone of a digital society, is what Estonia has experienced over the last 17 years. And this is why we think also that e-health during this 6-month period is important to be specifically work together and perhaps brought it to a next level of developments. We know, you all know, that there are many pilot projects. There is a lot of evidence that digital services in all public sectors, including healthcare, will bring value. And it is also important to understand why e-health is part of the whole agenda for the presidency, because e-health is part of the digital society in the largest sense. So in one hand, it is not possible to talk about e-health if you wouldn't have a broader digital society where people and different organizations and enterprises are comfortable talking to each other digitally, and vice versa. It wouldn't be a true digital society if healthcare wouldn't be part of that. Now, we know that healthcare usually is considered something that member states are dealing themselves, and then there are already certain areas where a collaboration across Europe has been agreed and mandated through different instruments and activities. Now, all member states are facing similar challenges, and all of them would benefit from better use of digital tools. Be it sustainability of healthcare systems, access to care, greater engagements of citizens, or quality of services. But also, equally so, all European member states are looking for opportunities from the digital single market. And in this specific area, healthcare services innovation or economic development from health industry as part of the data-driven new business models. Having said that, we don't think that what we need in Europe are new legal initiatives. At least during the 6-month period, we don't see this is the most important thing to discuss and consider, because we do have already locally, but also across Europe, legal acts, and I'm going to refer to some of them in a second. But we have noticed there is studies being conducted, and discussions usually refer that the implementation of these legal acts are not perhaps to the level that it would benefit all European citizens in a way that they could make use of the opportunities and advantages of the single market. Be it opportunities for a citizen going to have a healthcare service in another country, or a company that would like to offer a service in all countries, not just the one they started from. And that means that the free movement of data in healthcare probably, and we are very convinced in that, can make difference through hitting the triple aim. First, it is possible to increase the access and safety in healthcare if citizens are empowered and if adequate data will be available at the point of care, regardless where the original source of that data was. Secondly, sustainability of health systems is possible now than ever more before due to the fact that the data supports analytics, and analytics not just 5 years mortality, but even shorter time frames. And this could be put into work for the good of individual patients, but also at the system level. And last but not least, new economic opportunities and jobs can be created if data-driven approach in healthcare is also being used. Well, we know, but not that very often this is explicitly told out, that if we work together and collaborate, and in Europe very often that boils down to agreeing on certain legal framework, which has been done. But this is not alone enough. So there needs to be technology and data governance that supports that. And specifically, we know, we do have the confidence that most of Europeans already want to and can use digital health services if they are offered so. 76% of Europeans have access to fast internet, 79% are using internet, of which 70% do that every day or almost every day. And 52% European citizens want access to their health data, and very important, 70% are willing to share the data with others, including with a doctor, but also importantly, 23% are not yet willing to share the data. So whatever we offer, we have to acknowledge both of those two groups, and it is not given that people belonging to one or another group wouldn't at some moment want to be part of the other group. So the solutions that we offer must be flexible. Talking about the Estonian e-society, there are just few numbers. As said, the slides will be ready for you to be seen later on. Just if you look at the numbers, acknowledge that 1.3 is the population, 1.3 million is the population of Estonia, and last month 41 million queries on all databases that are available to exchange data in Estonia were made. Now, importantly so, you can see now on the left down corner here that big part of those queries are related to healthcare. Most importantly, Estonian Medical Prescriptions Center. So this has happened in Estonia. This is predicted to happen in all other countries as well. Healthcare will become big part of the data traffic that will travel from one place to another. Also, even though I told we have 15 years of digital society in Estonia, we have 10 years, close to 10 years of history of health information system. We can only recently see a rapid increase of the actual everyday use of those services in numbers. So close to 1/3 of people have used their patient portal last year. And what that tells is that if people are offered value-adding services, they come there. But in order to get there, it takes some time, and this is also why we think that the action is needed at European level, so that to ask today, theoretically, what and if people will use is close to impossible. But we know that if they are offered good services across border, across Europe, they will come and they will love that. The two strategic areas that we think we can work on during the 6-month period, and that possibly would have a strategic impact on all other issues that are also relevant and important in this domain, are first, to realization in practice, in real world, the right of citizens to control the processing of their health data. And by control, we mean both access, but then also to making sure that if needed, that data can be transferred to other doctor, or in an anonymized format also be made possible to be used in research or for service and product development. Which brings us to the second part. The secondary use of data is source for innovation in healthcare, but also source of economic growth. And In a layman's term, it would really mean that citizens, in order to have full control of their health, have to be in full control of the data. And it is the role of the public entities, be it national governments, regional governments, or European collaboration, is to provide infrastructure, both technical and legal, and governance around that, so that citizens can enjoy this right. And also, healthcare can and should be made really as an asset to societies, not only a cost item for public budgets. Just one slide and a few words about General Data Protection Regulation. We here believe, and we hope to discuss and come to a common understanding, that General Data Protection Regulation does facilitate better use of personal data. It is not a hindrance or a problem. Actually, it can be made as a competitive advantage as compared to other parts of the world. Because if we balance well the citizens' right to know and understand what is happening with the data, including their health data, and having right to mandate that data to be used also for the purposes that are useful and valuable to the citizen, everyone will come to Europe, and European citizens will have a very good opportunity to have the first-hand services, and at the same time feel safe also today and future about their health. And in a nutshell, the experience from Estonia and how we understand GDPR is that privacy in healthcare means, most importantly, that the data should be put in use securely, not be secured from being used. And to finish up, what are then the practical things that will happen during this 6-month period, and in more details about some of those activities Julien will tell you. You're all more than welcome. The registration has opened, as far as I know, to the high-level eHealth conference in October, where we try to bring together the experience, the already existing experience on eHealth from across Europe and around the globe, to have the understanding, what does it feel? What does it feel to live in a digital society and then enjoy health services using that digital framework? And then really I will only mention here the very important activity which flows throughout the presidency under the name of Digital Health Society, where we hope to bring together stakeholders who would give their strong voice through stakeholder declaration in Tallinn. And the first time we announced that, immediately the response was beyond what we could expect. The suggestion was not to remain just on the declaration level, but actually commit by public entities or stakeholder organizations across Europe on large impact cross-border activities. And this is what Julien will tell you in a second. And also, already in 2 weeks' time, health ministers will gather in Tallinn on the informal meeting and start working towards EU Council conclusions on e-health, which we hope will then have a strong political mandate to what politically the ministers and member states expect digital services to deliver at the European scale from the collaboration between different countries. So with that, I thank you very much for your attention and expect that there might be some questions that I'm happy to respond in some time. Thanks. Over to you.
Thank you very much. Thank you very much, Ain, for your presentation. So obviously we received already some questions, but you can still ask some question in the questions box at the right side of your screen. We still have a few slides to present to you, and then we will take the first questions. So I will present you. I hope you see my screen. I will present you some some slides about the process of the Digital Health Society, which was introduced by Ain at the moment. The idea was to have an as inclusive possible process as possible. So the idea was to have a full involvement of all the stakeholders in Europe, and I will explain how we come to do that in the next weeks. So the Digital Health Society is first. Do you see well my screen? The Digital Health Society is promoted during the Estonian Presidency of the EU Council, and so jointly between the Ministry of Social Affairs and the ECHAlliance. We have partners to develop the Digital Health Society, which is, as I said just at the moment, a multi-stakeholder initiative. The idea is to bring all the stakeholders involved in this field of the digital health in order to develop some concrete actions and concrete initiatives in Europe to deploy the Digital Health Society. So these stakeholders could be policymakers, governments, as the Ministry of Social Affairs in Estonia, for instance, but many others. But it's as well the citizens themselves, the healthcare professionals or providers, the companies, the payers, the local authorities, universities, researchers, well, a number of people you see here in this diagram. And the idea is to act during this presidency, and this is the wish of Ain and the Ministry of Social Affairs, to act at the same time at very high level representative of European governments. So European member states and the EF network are working on political agenda with the European Commission on the deployment of digital health. But as well, and a very important aspect, with people on the ground and people implementing everyday innovative solutions. So the people doing the digital health or the people on the ground. So this two-level approach will allow, hopefully, to have tangible impact within the next month. So we have developed a first version of a text called the Digital Health Society Declaration. The HS stands for Digital Health Society, obviously, in the rest of the presentation. So the declaration is a text, and its aim is to be co-built by these stakeholders and co-signed as well. The signature will be a bit later this year. I will let you know later. And the idea is to build together a kind of manifesto, if you want, expressing the main challenges for the digital health deployment and the different initiative or solutions or progress that each kind of stakeholder, each category of stakeholder has to do on these challenges. So here in the slide, you can see in the boxes, colorful boxes, different challenges we can have in Europe about the deployment of digital health. And because it's not only the responsibility of a policymaker or not only the responsibility of a citizen or a professional, which kind of collective initiative or collective movement, collective actions or commitments we can take in order to work on each aspect of these challenges. For this, obviously, you can see here in this slide many challenges. Here 8 are mentioned, but we have decided as well to do kind of sprint accelerators for specific challenges because we think they are not more important, but they are critical if we want to move forward this digital health society. So the idea is to create some task forces. Here we present you today 4 topics around which we decided to accelerate and to gather some high-level experts and some doers or implementers from all Europe to create this task force. But it's possible that in the following week that we create some more task force or more topics. But the 4 first topic that we wanted to push today are this one. So the first one is around the design of a convergence roadmap about interoperability standards and digital telehealthcare protocol. So the idea is to bring together some member states, some players, some companies in Europe able to agree on a range of standards that they are already using, and a roadmap, action plan in order to converge within the next year across Europe to unify their system. The idea is to don't invite 27 or 28 member states in this group. The idea is to start with a small group of doer implementers taking concrete and tangible decision in a short term and leading perhaps for other member states to join them. The second topic is around what we call the data donors campaigns. The idea is to inform and communicate to the citizens what are the benefits of sharing data. If the digital health society wants to be developed, we need to inform the citizens on the benefits that they will have to share their data, and which kind of platform as well they could trust in order to share these data. So this kind of data donors campaign, on the model of what is done on blood or organs, are something that different member states or regions are interested to work on, and different citizens or patients associations as well. So we will develop a specific action plan on that as well. The third topic is about the legal framework. I mentioned the GDPR, the regulation on data protection, but obviously the GDPR is covering a large spectrum of aspects of this legal framework, but there are some local laws and local rules for regions or countries and principles of use of data that should be set up as well by the member states and the regions. So the idea of this task force is to work on best examples in Europe, because we already have examples of local law that could complement the implementation of the GDPR, in order to facilitate the free flow of data, which is one of the main objectives of the Estonian presidency, as I underlined just before. And the second use of data, this second use for research purpose or services purpose, and the idea is to improve that. The fourth topic and last topic presented today is about digital transformation and change management. Obviously, if we want the digital health society, we need to adapt our healthcare organizations, an hospital, an healthcare service at the national or regional level. So there are some tricks to manage this change, and we want to publish some recommendation with some big managers of healthcare services or hospitals involved in this task force. So each task force is expected to publish conclusion by September this year, and it will be published publicly by us. Meanwhile, before this publication of the conclusion, we launched today a consultation. We launched collectively this consultation across Europe. It's very broad. The idea is to allow everybody to contribute to this initiative of the Digital Health Society, and to be a partner and a stakeholder, an actor, a player of this Digital Health Society, expressing your point of view and sharing your ideas or your experiences and your existing solutions as well, because we know that we don't have to reinvent the wheel and to take what is already existing. So we have launched a page. You have here the URL in order to collect your point of view, to share your ideas. We will publish these ideas and display these ideas, so it's not an anonymous consultation. We ask organizations or people to commit themselves in what they are proposing, the opportunities or the solution they are proposing. It will be publicly displayed, so take that in mind. And the idea is to contribute to this Digital Health Society development, to the task forces, and to be able to enrich this declaration, Digital Health Society Declaration, that will be signed later. So the timeline. So today we have this webinar on the left side of the slide. We then set up this task force during this month, and we launched the contribution in July and August. We asked people to submit contribution on the website I've just mentioned before. So basically it's on ECHAlliance.com. We ask people to submit suggestions before the 30th of August. The task force will publish at the beginning of September their report and their conclusions, and then the task force will be open to commitments. So following the report and the action plan, the roadmap published by each task force, people, and when I say people, it could be member states, it could be researchers, it could be companies, it could be hospitals or healthcare providers, can commit to this action plan, saying, okay, I'm interested by this action plan. I want to act myself at my level on the following this recommendation, and then you can commit. And then this commitment period will end at the event in Tallinn. I will introduce just after about the Digital Health Society, the high-level conference that I mentioned just before, which will be the 16th and 18th of October in Tallinn. And we will have a presentation of the different task forces, a presentation of the declaration, a signature of the declaration by the willing organization, and other big workshops I will present just after. And then after this date, during the rest of the presidency and after the presidency, it is expected that the Digital Health Society will continue to act, and the task forces, these one and new ones, will be created, and to develop action plan, projects, funding for these projects, and will act to implement a digital solution. You see on this slide a deadline as well for the program of the conference on the 20th of July at the left side of your screen. I will talk about it at the moment, just now, about this conference, but we accept as well some suggestion, and we are welcoming some suggestion about the program until the 20th of July, so this month. So it's the first deadline that you don't have to miss. So this event we will have in October, quickly, to finish this presentation. The idea, the title first is Health in the Digital Society and Digital Society for Health, from the 16th to the 18th of October in Tallinn, co-organized by the Ministry of Social Affairs of Estonia, ECHAlliance, and IMS Europe. The three of us are coordinating this event, which follows three mantra, I would say. First, to build a citizen-driven demand in e-health. The citizens are the heart of the system. And I think it's very important for the whole presidency, actually, and what President Ain this morning is in line with that. Here, supporting the value-driven and sustainable health and social services. Obviously, we have some challenges around sustainability, and digital health could support that. And e-health as a driver of innovation and economic development. So when we are talking about digital health, we're not talking about public health policies or health public policies, but as well economic development policies. So, so these three mantra will be illustrated, I would say, across three tracks. More than 50 speakers. We expect more than 700 attendees from Europe, US, Canada, China. Well, the list is not exhaustive. You have the website of the event here. Here it's Tallinn2017.ee. And we expect an audience, you have here, and I will let the slide, I won't describe this one, from different countries, from different kind of industry. The tracks, the three tracks we are developing are here. Take this. Well, the tracks are decided, but the topics I put on this slide are ideas of topics, so it could move a little bit, but it's to give you indication on what we will try to discuss during this conference, with keynote address, with panel session, with workshops, with pitching presentation by startups, etc. The first track is around citizens, professionals, and society. So, for instance, the data donors idea I present in the task force will be present there. The track number 2 is about digital infrastructure, data, and technologies in general, so the new technologies. I've seen that we had a question already on blockchain. It will be one of the sessions, virtual reality or cybersecurity, etc. So we'll be presented in this track. And the third track is what we call the enabling environment. When you have the people in track 1 and the technologies in track 2, what is the enabling environment we need? So it means the legal framework, the business models, the willingness, the communication, the training, well, all the aspects that will enable this sector, healthcare, to really digitalize and the digital health society to develop. So these are the topic, and we are open until the 20th of July. On this, you have at the top left the email address. We are able to integrate new ideas in this program. Here you have the website, and we expect you on this email address and ECHAlliance.com for more information. As I said at the beginning, this webinar is recorded, and the slides, Ain slides and my slides, will be online in a few hours on ECHAlliance.com. So we invite you to go on it. Thank you very much for your attention. So. We will move now to the session of questions. We still have 25 minutes for questions. We already received a lot. I invite you to write more questions on your on the question box at the right side of your screen. First question, perhaps Brian talked at the beginning, but first question about we had the first question was about from Nishad was about the non-European countries, if they can contribute or benefit from the presidency. So Brian, perhaps you can have a word about that.
Yes, certainly. First of all, thank you all for all your questions. I have to be honest and say there are so many coming in. I have to tell you now, we will not be able to answer all of them in 25 minutes, but we will try to take samples of those later and let you know what the questions were. So on the question of non-European countries, even in this webinar, my understanding is we have people joining us from the States, even in their Independence Day celebrations, and from Canada and from China, and I think also from Singapore and Australia. There is a great deal of interest in the whole concept of a digital health society. They're all at different stages, maybe a different stage from Europe, some ahead of us, some behind us. And the answer to your question is, please feel free to contribute to the consultation that Julien spoke about. It is literally open to everyone and anyone. So when you receive our newsletter later today, please do give your contribution to that. So the answer is you're very welcome. The method is contribution through the consultation, and if possible, obviously come and join us in Tallinn in October. Next question, Julien.
Yeah, so we have a question about digital health literacy and his skills. Obviously, training of people on the ground, I was saying at the beginning, is very important. It's asked by several people here. Perhaps, Ain, there were a question about what Europe can learn from Estonia about the digital health literacy and his skills, given the fact that Estonia is one of the most advanced countries in terms of digitalization. What can Europe learn from your country?
Thank you for the question. First, there are many countries in Europe that are leading. It very often depends what you measure. When it comes to public e-services, then certainly we have been able, from different departments, to provide now more than 1,500 different services. And then perhaps one lesson, actually I would even give two, is that public sector can lead and actually create gradually this trust that very often is said to either have been lost or has there been hesitance from the beginning, that if you don't force people do things but actually offer them more comfortable, more convenient ways to interact with the state, people will come behind that. And secondly, referring to digital literacy, it would have not been possible if Estonia would have not worked together with the private sector. In the end of 90s, there was a movement called Look into the World, whereby Estonian government, together with all the large telecommunication enterprises and large banks that we had in Estonia, trained 10% of adult population in basic skills for using computers. And we know that these kind of large-scale training programs, be it for general skills or specifically how to use digital solutions in healthcare, are needed, and they do bring value. And this is again that private and public sector working together would benefit both.
Thank you, Ain. Thank you very much. We have a question, more technical question for you as well, Ain, I think, around blockchain. Several questions around blockchain. I mentioned that it will be a topic at the conference in Tallinn next October. The questions were around, do you use blockchain technology in Estonia? I think the answer is yes, but you will confirm that. And how do you see the future with this technology?
Thank you again for the question. The answer is yes, and the answer is that we used it already for last 10 years, but perhaps sometimes some technical people have told me it depends on how you define that. So the ledger and way of hashing meta information to maintain the integrity of the data is the core part of the Estonian health information system. It has not been a distributed ledger, which is kind of the more narrow definition of blockchain technology. And just recently, we started to collaborate on one private company in Estonia to add an additional level of security, so that the people or organizations in Estonia do not have to trust just the government for keeping their data secure, but there is an additional part of meta information which is hashed and stored on a private cloud in a distributed way, so that we can be more or less as absolutely sure as one can be, that the data that is being used and later on is actually what was stored there in the original form, and that we also know who and when has accessed that data. So I do believe that this is will be a very important technology in the future. And remember that slide that I showed, that the recipe for digital society is the combination of legal framework, technology, and data governance. So as the technologies evolve, also the new ways how to translate the legal principles into action, and what are the data governance models that will enable to do that in a flexible way will come. So big future for blockchain technology.
Okay. Thank you very much. I think it's very clear. We have many questions from you about how to engage with the digital health society, how to engage with task forces, etc. Maybe Brian, you want to answer to these questions? Maybe I was not completely clear on my presentation.
Okay, fair enough. I think first of all, it's good to see so much interest in wanting to assist in the overall process, plus of course to actually participate and contribute to the task forces. We are in the process, and by that I mean within the next couple of days, we will, and this is to answer another question, we will, that is the Estonian government and ourselves, will appoint the initial leaders of each task force. They will then either appoint co-leaders and will then set up the process by which you can participate in those task forces. So there's a couple of things. One, participate all of you anyway, please, in the broader consultation. And two, within a few days, we hope to announce the leaders of each of the task forces, and we will set out the process then by which you could participate in those task forces. Obviously, each task force leader may have their own ideas on how they would like, how many people they would like in their initial task force, but more details, I would hope, by the end of this week. But it's good to see so much interest in the task forces themselves. Could I just go on, Julien, to answer, if I may? There's a lot of questions as well about where this fits with the overall activities, the many, many initiatives in Europe. And here I'm indebted to both Maggie Ellis and to Mark Lange, Mark from ECHAL. When the initial draft of the declaration was produced, this followed on from many, many meetings from between the Estonians, ourselves, and the commissions. And as a result, we definitely see, and we know they agree, that the Digital Health Society is more like of an umbrella, for want of a better word, to help and encourage all of the initiatives, including, for example, the blueprint, including things like the work already underway on EIP-AHA, the fact that the European Commission announced their midterm review. And therefore, I want to make it clear that from our point of view, we see this as complementary and supportive of the existing initiatives. And we hope that creating the Digital Health Society will assist in accelerating all of those processes. I think, because there are so many questions in that one, and we will, I think that probably covers the point I want to make on that, Julien. Over to you.
A complementary point was the question around the EU Council, maybe for Ain to explain, because the European Commission has announced a communication, I think it would be for October or November, on digital health, e-health, so it means that normally following that, EU Council will have some conclusions. What is the process beside the multi-stakeholder one we are presenting today? What is the process at the EU Council level?
Okay. As said already several times, there is a lot of excitement around digital health, and perhaps also for a good reason that from the pilot stage we are entering the stage where digital health will be part of the mainstream health. As I said and showed on my title slide, Estonian presidency is a platform. And on platform, many things can and will happen. So while we have partnered up with the ECHAlliance and have give birth to this initiative, which we will see where it leads, called Digital Health Society, but really which was meant to collect better understanding to support the cause that we have. Now, health ministers, and again, it was in 2009 when health ministers during Swedish presidency, I believe, had a say on digital health, and before that it was also a long time. So in order to get kind of very strong message to the ministers that it is a political thing, but we need also political guidance where to go together from the member states' point of view. All those other initiatives, including the communication that the European Commission has started, we have agreed with the European Commission that we work together with them. The presidency is there to hear from everyone, and as said, in 2 weeks' time, health ministers will discuss what is the member state position, where we want to lead the common consensus on what would then become Council conclusions, and then incorporate on the way also initiatives such as the communication as suggested by the European Commission. So I believe that we manage well with our presidency to take input as much as possible, but by all means we cannot fix the world in 6 months' time, so that we hope that the momentum will last long after Estonian presidency, and we know already several of consecutive EU presidencies have approached us, and we have started discussions how to proceed with all the good thoughts and suggestions that will kind of brought up during this 6-month period.
Thank you, Ain. I think it's very important to what you just said about the fact that the idea of digital health society is to be a link as well between the different presidencies beyond the Estonian presidency, and to be ongoing actions or action plan. Obviously, we won't solve all the questions in 6 months, so the idea is to link with the future presidency coming, Bulgaria, Finland, and others, to develop these actions. I think it's very important. If we take another question, perhaps to come back on more detail on the content. There were questions about the validation of digital solutions. Perhaps Ain, there's different work in Europe happening, and you are the first place in the HEALth network, I think, about this topic, about how to certify or validate mobile apps, for instance, or digital health solutions without going through the classic randomly criteria trial, and how to evaluate these solutions and to be sure that it will benefit to the professionals and the citizens. Is it something that you aim to discuss with your partners during the presidency?
The answer is yes. And here I'm wearing more than one hat. First, ECHALLIance network has started a special staff group working on mHealth, where we agreed on the first, let's say, the line of action that's led by ECHALLIance network, but in collaboration with all other activities around that, should start working from. And there we came to, and the action plan is being discussed in the framework of the multi-annual work plan for ECHALLIance network. But it is clear that there needs to be some sort of coordination also on standards, so not immediately kind of full-scale standardization in the mandatory format, but as mentioned already in the title of one of the task forces for digital health society, there is a convergence among certain member states that can agree upon the core set of standards that would then allow a faster deployment of mHealth solutions, including then what that certification should mean. There is also directive on the medical devices that is very much related to this topic. So where is the line between a medical device and an mHealth app that is not that? So the agreement on standards also then needs to have best practice examples on how different regions or countries have started to solve that solution. We also made a survey prior in preparation for the presidency, so we think we have some understanding what are the best practice examples that are available. And again, one very important line of action that we suggest, and we can agree, and perhaps also the European Commission can support that, is to start developing a compendium or something which would help those who want to implement in a coherent set a coherent set of certification solutions or principles, so they know already which one have been tested, what have been proven difficult, and to the level that maybe some of those technical platforms that have been implemented, say by Denmark or Catalonia or Andalusia, or what is also in the development in Estonia, maybe some of them also would be available to more than just those countries or regions that they are implementing. So sharing best practices, converging those member states who are willing to work closer together in order to create larger market. So which is very important both to companies who would come to Europe and not only seek opportunity in the United States or in Asia, but also for citizens, so that the services that the private companies are offering would be available also here and they wouldn't have to wait for them for too long time.
Thank you, Ian. Thank you very much. I see many questions as well regarding the event. So what I said just before quickly is that we are still open to suggestions for either speakers or sessions topic. We are organizing different type of session, but the classic panel session is with 3 speakers and the moderator. So I had this question. So it's until the 20th of July, and you can write us on the address I put with your suggestions. So by the 20th of July, we will close the suggestion for the conference. I saw as well a question on GDPR implementation. Some member states are struggling with the implementation of the GDPR. Some companies, I would add as well. So it's one of the topic we have in the 4 task force we have presented. The task force number 3 is around the legal framework. So how the GDPR and the local adjustment that member states, regions, and sometimes companies have to do to their activity or their area will be one topic of the task force, and we aim to publish at the beginning of September some guidelines and best practices, best examples on that. The same model as what Ian illustrated on mobile health. One question about the sustainability beyond the presidency. We have a few minutes left of the Digital Health Society. We explained that it will be completely coordinated by with other initiatives, Blueprint, TAP, AHA, Innovation to Market Plan, etc. But how it will survive afterwards and how we will fill the project and define funding for this project, because obviously funding will be a key question. Brian, you want to say a word perhaps on
yeah,
that?
just it is. I'm looking at the many questions that have come in, and this keeps reappearing. The answer is that, being very honest with you all, we're all a little surprised, I know Ian is as well, at the response that we've had to the announcement of the Digital Health Society. So we have over 100 organisations already keen to contribute, and some indeed have already been contributing. It is clear that we have to find a way to sustain this movement beyond December. Therefore, we're in discussion with the Estonian government and with others to see if we can find a mechanism to continue this movement. Not only because we think that during the period up to December, we're going to focus on real things. Let me give you a quick example. Tony Dedu from Catalonia asked a question about, you keep talking about health, where is care? As an example, on the first task force, we already have had approaches from people who want to include a protocol on care technologies and care services rather than just focus on health. These are the practical examples we want to extract before the end of the year, and then we will be looking to yourselves particularly to help the Alliance with the involvement of the Estonian government to sustain this and it become just a continuous movement. We're still in discussion about that. We don't quite know how that's going to work yet, but we will keep you up to date. And obviously any thoughts, suggestions are always welcome of how we could sustain it. I think just on that, there are so many questions here that I think that all we can do, in fairness to all of you who have spent an hour with us now, is we will review all of these questions. We will not ignore them, and we will do our best to answer as many as possible after the webinar is over. And if you haven't had an answer during the webinar, apologies, but we've had such a number of people on that it's been impossible to answer everyone's questions. Over to you, Julien. I think we're just about out of time.
Yeah, we will close just to say that in any case, we have this communication channel open, completely open with you, with this email address that we will put again online, and we will send you the link. We have the website ECHAlliance.com where we will display all the information, and the consultation, the survey we launched today is as well the way to express the existing initiative, the existing solutions, to don't reinvent the wheel, and the suggestions on how to influence. Again, it's an inclusive movement, Digital Health Society. The idea is to integrate all ideas. We will, as Brian said, we will review all the input that we receive from your question today and from the consultation. So please feel free to express all your ideas, and we will do our best to integrate them to the initiative. Maybe Ian, you want a conclusive word about this session? and the launch of your presidency.
Well, once again, thank you. It is a humble excitement that I would like to express on behalf of the whole team. So that this interest tells us that what we have taken up is important. We also hope that you understand that this will probably be a continued effort beyond Estonian presidency, and so some of the priorities that will come up from these discussions that we are capable of focusing during the 6 period of time doesn't mean that maybe some others that might need some more maturation would come up later on as well. So I really hope that you can maintain your enthusiasm and support, and that we will make e-health and digital tools truly a part of one of normal and desirable future for health and care. Thank you very much.
Thank you very much, Ain. Brian, do you want to say a word?
Just to say thank you to everyone. Again, thank you.
Thank you very much. So I invite you to join ECHAlliance.com in a few hours. So we will publish the information. The consultation will be online. Is online actually at the moment, and you can already still participate and contribute. Thank you very much for joining this morning, and we'll keep you all of updates as soon as possible. Thank you very much. Have a good day.